Hello, everyone. My name is Charlene, and today's topic is the epidemic of loneliness in Missouri and its impact on public health. We'll discuss key policies, their potential, and the roles of government in addressing this issue of loneliness. Over one-third of adults in Missouri report feeling lonely, with the elderly and marginalized communities most affected. Loneliness is connected to the health outcomes like health outcomes like cardiovascular disease, depression, and early mortality. Now we'll go into policy number 1. Social determinants of health approach. Improving housing, transportation, and access to community spaces can reduce isolation. Funding community centers that offer special programs and wellness activities will give the at-risk communities a space to connect. Systematic barriers like poverty and unequal access to resources play a huge part in the loneliness epidemic. Next is policy 2, mental health integrations into primary care. Embedding mental health screenings and services into primary care can help identify loneliness early. Routine screenings for social isolation during annual checkups is a good way to service more people and provide connecting services. The benefits are stigma reduction, cost effectiveness, and better access for vulnerable populations. Now we'll go over the roles of the 3 branches of government and how they will assist in the loneliness epidemic. The legislative branch can propose ordinances and allocate funds to combat loneliness. An example would be introducing a community connection initiative in Jackson County to fund social programs. It is important to pass inclusive policies to support vulnerable populations. Next is the executive branch. The executive branch can implement policies, form partnerships, and lead public awareness campaigns. An example of this is a program like Engage KC, which connects residents with mental health and social resources. Leadership is needed when creating sustainable, impactful initiatives, and that is a part of the job of executive branch. This branch of government is the judicial branch. Their role is to ensure legal compliance and protecting equitable access to programs. An example of this is upholding anti-discrimination laws in service delivery. Fair legal processes are also needed to support vulnerable populations. In conclusion, I think the best approach is integrating mental health services into primary care due to it being the most effective approach. The benefits are it's scalable, cost-effective, and reaches the most vulnerable populations. The goal is to encourage collaboration across sectors to make this vision a reality. By prioritizing systematic changes and investing in the community-driven initiatives, we can improve the well-being of vulnerable populations and reduce the health consequences of loneliness.